Welcome, everybody, to the workshop Addressing Cognitive Challenges After Transplant and CAR T Cell Therapy. My name is Sue Stewart, and I will be your moderator for this workshop. Before we begin, I'd like to thank Jazz Pharmaceuticals, whose support helped make this workshop possible. It's now my pleasure to introduce to you today's speaker, Dr. Thomas Bergquist. Dr. Bergquist is a neuropsychologist and part of the brain rehabilitation team at Mayo Clinic. He is also an associate professor of psychology in the College of Medicine. Board certified in clinical neuropsychology, Dr. Bergquist is a co-investigator on a study of the use of the internet to deliver cognitive rehabilitation services to rural populations. His principal research interests include rehabilitation following brain injury and coping with disability. Please join me now in welcoming Dr. Bergquist.
Well, hello, everybody. Thank you for that very kind introduction. I'm very thrilled, even honored to be with you all and present on a topic that's near and dear to me, and that's dealing with cognitive challenges that occur after medical conditions, in this case, after transplant and CAR T cell therapy. Specifically, we're going to focus on managing these cognitive challenges after transplant and what can be done and what evidence exists to support different strategies to help in managing these cognitive challenges. Just if you indulge me here, a little bit about where I'm from. Mayo Clinic is in Rochester, Minnesota, in the middle of the great upper rural Midwest. You can see one of the icons of our city besides Mayo Clinic in the upper left is we're very proud of our corncob water tower, to the point that even when the plant that this water tower was part of, it was a food processing plant, closed, there was a successful lobbying by the city to maintain this as a proud city landmark. In the right, you can see the entrance to Mayo Clinic. In the middle of the second row are a statue based on a photograph of Dr. Will and Dr. Charlie, the two Mayo brothers that really founded Mayo Clinic. Its founding now been over 150, almost 160 years ago. Now, what we will be discussing today, in particular, just types of cognitive strategies that can help you address the cognitive problems you might be experiencing. How do these strategies help you enhance your day-to-day performance? What are some benefits of managing your cognitive problems? And what to do if you're having trouble making the changes needed to manage your cognitive problems in day-to-day life. What we will not be discussing today, in part because it was discussed very well last year in a talk which I understand is available on video given by Dr. Michael Parsons from Mass General Hospital in Boston, at least not much, initially, is evidence of the impact of chemotherapy and cognitive functioning. I'll describe that briefly, but he's had a wonderful talk describing that in some detail. The other thing I'm not going to address directly, there's just not time, is the effects of various medications on cognitive functioning or pharmacologic interventions to enhance cognitive functioning, and there are some that can potentially do that. Having said, I won't discuss this too much, just briefly, and just to acknowledge, the reality here is that chemotherapy can change cognitive functioning. Specifically, and you can see it in the lower right, this is mostly taken directly from Dr. Parsons' talk from last year. There are multiple brain areas affected. Some of the areas impacted are, besides those areas, the nerve fibers that connect brain areas are vulnerable. There are certain brain areas that are particularly at risk. One of them is the hippocampus, which is responsible for new learning and memory of new information. And another point that Dr. Parsons covered well are the widespread effects that suggest there is toxicity throughout the brain, with particular areas, however, being more vulnerable than others. What cognitive rehabilitation does, and what we're going to focus on here today, is provides a way to improve impaired cognitive functioning. Cognitive rehabilitation is a type of therapy based upon an assessment and informed understanding of a person's cognitive, or another better way to put it perhaps, is thinking challenges. And cognitive rehabilitation can help improve thinking skills by two basic ways. One is to strengthen old ways of doing things. Another way, which we'll focus on more here, in part because it can be even more effective, is establishing new ways, or what one patient told me, workaround, to compensate for thinking skills which might be impacted or might be impaired. Is there evidence to support cognitive rehabilitation? Well, the short answer is yes, there's a lot of it. I could spend multiple hours discussing all this evidence and what the evidence says, but here's just several sources. These are actually contained in a reference list at the very end of the slides, so you don't need to worry about writing these things down. On the left are 3 textbooks, the bottom of which I was a contributor to. I have nothing to disclose here. I don't get any money from this, but I was a contributor to this major textbook published by the American Congress of Rehab Medicine. The other 2 are outstanding textbooks, mainly designed for practitioners applying cognitive rehabilitation. And on the right is the evidence on which a lot of these textbooks were based. There's 3 or 4 general categories of evidence that have been produced. One is from a group from Australia, the NCOG group. The second one is a group from the American Congress of Rehab Medicine that I've been part of. We published many evidence-based reviews. And the bottom 2 are from a group of speech-language pathologists and occupational therapists. Common cognitive changes due to chemotherapy. There's really 4 areas that have been changed in the literature, are identified in the literature. One of them is attention, the next memory, the next processing speed, and the next executive functioning. It would take a long time to focus on all these different areas in terms of what can be done. But what I'm going to focus on today, because it's probably the most common one, and the people really impacts their lives the most, and that's memory functioning. Also, you'll notice, if you recall in an earlier slide, I said that the hippocampus in particular was impacted by chemotherapy and treatment, and that area has a lot to do with memory. So as a result of that, I'm really going to focus largely on memory functioning today because of the importance that has in terms of day-to-day life, and also because of the impact that chemotherapy has in particular on that area of functioning. So just a quick summary, and this is from, just kind of help us understand how memory works. There's a whole lot of research on how memory works, and I actually did my dissertation way back when, 30 plus years ago, on how memory works. But here's just a quick summary of it. There's the input, kind of the learning that occurs, and you'll notice in that file there that it requires a lot of attention, concentration, and even some elements of executive functioning to learn new information. We put that in the file drawer, and then we store that information until we want it, and then we retrieve it later, and then we recall or take out that information from what we've stored. The old saying people use often in IT, garbage in, garbage out. The degree to which you can recall information is to a large extent based on how you've learned it and how you stored it in the first place. So even if you have trouble recalling it, it's not just a recall problem. It can also be a problem with how it was learned in the first place. And some of the strategies we're going to talk about help in both areas to help you to learn that information effectively initially, so you can recall that information effectively when you want it later. Now, to summarize, if you're having difficulty with your memory, if you're having difficulty learning and recalling information, organizing information, there's 2 basic approaches you can take to help you enhance how you're doing. One of them is external compensation, and another way to put it is things outside of your head, things you do that help you, recall information besides just thinking about it in your head. And 2 of the basic techniques to do this are electronic devices these days, what we would call a smartphone, an iPhone, some other kind of phone, whatever it is, or sometimes there's other devices that can help with this as well. And then a memory notebook, and just a notebook that has various sections in it based on what you want to remember, and we'll describe that in a little detail here in a few minutes. But those are the basic 2 techniques or things that can use in terms of external compensation. Internal compensation, and that's inside your head, something you don't do with an outside device, something that you do just internally. This can include association techniques and then organization and elaboration techniques. And again, I'm going to describe these more, and actually you're going to have to do some work here. I'm going to have you use one of these techniques, and you can just see how effective it potentially can be. Now, this isn't a false dichotomy. In other words, it doesn't use one or the other. For most people, we're probably going to use both of these to some extent, depending on the situation and depending on the memory problems we're having. But those are just, again, the 2 general categories that we might choose from. Now, we're going to start with external compensation and some examples of that. Or just to explain it further, external compensation involves using a device We talked about those devices in the previous slide to help you to learn, to help you retain, and recall information which you might otherwise forget. It can be helpful even in persons with significant memory problems. I've worked with many individuals who really have such severe memory problems that they have trouble remembering the day, remembering even family members they've known, and their memory problems are pretty severe. But over a period of time and with a lot of repetition, working with a therapist that is skilled in this area, they can learn, these external techniques to the point that they can become surprisingly independent with their memory functioning, even despite those significant memory difficulties. Sometimes people even refer to this as their external brain, because in a way, the word I said earlier, it's compensating for, it's working around the memory problems you're having, and in so doing, allowing you to be much more independent and functional in day-to-day life despite those memory problems. Now, again, just drilling down more on different kinds of external devices, there are notebooks, other kind of planning systems, things like iPads and laptops, smartphones, as we mentioned, computerized systems, which of course can network with iPads and smartphones. There's auditory and visual systems and task-specific aids. It would take, again, a whole lot of time to get into a specific, list of all these things. What's happened over time, though, is, years, even a decade ago, there used to be a whole bunch of different devices, but just the way things have evolved, that smartphones have kind of co-opted all these things. That, in other words, you can record things on your smartphone. You can keep a calendar on your smartphone. You can, put a to-do list on your smartphone. You can save people's addresses and names and even their pictures on your smartphone. So many times you can have all these in a central location, negating the need for all sorts of different devices. But whatever you do, there's not one size fits all. It's good to have something that's really designed to really help you based on your situation and your needs. And the other thing I should add, that if you're someone that's really never used, most people these days use a smartphone, but not everybody does. And if you've never used that, and it's really foreign to you, and it's not something you've done, and you're having memory problems, then we really don't want necessarily you to learn something new when you're already having trouble learning something new and going with, as opposed to if you're used to writing things down and doing it that way, then that's probably the way to go. So again, the idea that we want to do things based on your situation and what really works best for you. And kind of moving on from that, to choose the right device, you need to ask the following questions. What do you need to remember? Not everyone needs to remember or wants to remember the same thing. For example, if you want to remember, the names of people in, your extended family or friends you have, new friends you have, I always have trouble remembering their names, you might do something different than if your need is more to remember future appointments or future dates. And you might need to use both of those. And again, both of those might ideally have them in the same location, because to do that, you only have to go like one-stop shopping. I can find all the information I want in this one place. You want to do something based on what your goals and preferences are. And you want to do something based on the features and limitations of available technology. If you're having difficulties with vision, for example, for some reason, or you have difficulties with hearing, there might be things that would work better or worse based on those particular needs. Where are you going to use it? Having a whiteboard in your home where you have information you want to remember in your kitchen or a central location is a wonderful device, but you can't take it with you. And so if you want to remember something to do when you go to the store, you might probably want to use something else. But for example, if you have a smartphone and it can take, like most smartphones do these days, it can take pictures, then you can perhaps take a picture of that whiteboard and take it with you to the store if you have the grocery list on there and use it in that fashion. And then again, as I mentioned kind of in the last slide, your familiarity with the device and use. If you're having, I've seen this many times, if you're having difficulties with remembering and keeping track of information, and someone says, wow, I have this great app, this great thing, but it involves a lot of complex learning and learning a lot of new things, that might not be the way to go, because learning a lot of new information and a lot of new facts and techniques when you're already having difficulties with learning is perhaps only going to result in frustration, as opposed to if there's something that you've already been accustomed to do or something you're already comfortable with, if that can be possibly leveraged to help with memory, then that's probably the way to go, at least in many situations. Here's just some examples of a memory notebook. When we used to talk about a memory notebook, it was always, a paper and pencil notebook. Real quick story, there was an NFL team, I think it was the Cleveland Browns, who, football, besides being athletically, gifted and having a lot of good physical strength and abilities, you have to remember a lot of plays, like a lot of sports. You have to remember a lot of information. And the first weeks and months of training camp, and even throughout the season, most teams in football, every sport for that matter, they really need to lose a lot of information. I read a really interesting story in the New York Times where they were looking at all these electronic devices to help their football players. And of course, the resources were pretty much unlimited. If there was an expensive thing, that didn't matter. They could buy it. And what they found after using all these devices with their players is, guess what? That the thing that really worked the best for their players to remember all these new plays, names of coaches, names of fellow teammates, everything else, was to give them just a good old-fashioned notebook and, a few nice pens and have them write down the information and carry the notebook with them everywhere they went. That really worked better than any electronic device. I thought that was a real interesting thing, that even with all these wonderful electronic, smartphones we have, that sometimes the best way to work is just a good old-fashioned paper and pencil. I use that in day-to-day life for a lot of things. And you can see an example of that, the right picture. And actually, that's the one that we here at Mayo Clinic produce our own books to give to our patients for just a nominal cost that they can use in day-to-day life because it seems to work. And the information you might want to put in that is like a to-do list, a memory log, or kind of a journal, your daily schedule, things you need to do, homework, history and background, things from the past I want to remember, handouts or just things maybe you've gotten as part of your treatment, part of your therapy, and then important contacts, both family members, medical team, anything like that. Things that can be done with the help of external devices are remembering to perform something in the future, a future action. Bring a book with me that I want to share at a family gathering. Tell a family member what I did today. Oh, gee, I did this thing, but I can't remember what it was. I know there's something I wanted to tell you. How many times has this happened? But I can't remember what it was. Well, by developing the habit of recording that in that device, now you need the device, but you also need to develop the habit of doing that. I can then help, remember that information. Store and retrieve sets of information, dates of upcoming medical appointments, types, and names of medications I want to use or questions I want to ask at my next medical appointment. Reporting information from different activities, things that you've done in the past but you want to report to somebody. Activities from a family gathering that we had during the past weekend. Reporting information from a work meeting. I work with a gentleman that had a pretty severe memory problem due to, in his case, a traumatic brain injury he had, over 20 years ago. And I still check in with him periodically just to kind of keep things going as they need to go and just make sure things are as they should be, about once a quarter, every 3 to 4 months. And I ask him what's going on in his life, and the first thing he does is pull out, in his case, he uses just a paper and pencil book, and he tells me what he's done, last, week, the week before. He has questions written down that he wants to ask me now. He worked a long time with our therapy team to develop the skill to do that. But if he didn't do that, I'm pretty sure he wouldn't have very good recall of the questions he wanted to ask me, and he wouldn't have very good recall of the things that have happened in his recent life. And then he writes down what we talk about so he can implement it. And if he didn't do that, he probably wouldn't remember that either. But he's developed that skill and uses that, external device to help him to do that, and it helps him to be much more independent than he would be otherwise. Now we're going to move on. We talked about external compensation. We're going to move on, to internal compensation. In other words, doing it in your head. And this works through the process of association to a large extent. And you want to associate something new, and that new thing is what you want to remember, with something that's familiar to you. And this can then help you to learn that information and recall it later, when you need it. And how do these strategies, this internal compensation, even work? Well, we use mnemonics. What's that? It's a fancy word for techniques that aid with learning, storage, and recall of information to promote learning. Remember information, in this case, without use of external compensation. So as I said earlier, you probably want to use both of these different approaches, but you can, if you use internal strategies, if that works for you, then you don't need the external compensations. It can be used with verbal information, like somebody's name. It can be used with nonverbal information, like of course, the one that always gets me, where did I park the car today? And it can be used together, as I already mentioned, with, and sometimes that's the best strategy, with external strategies. Okay, different types of internal strategies. There's three basic categories. There's association techniques, there's elaboration techniques, and there's organizational techniques, and we're going to go over all three of these. With regard to association, one technique is called visual PEG method. Well, what the heck is that? Its items to be remembered are linked with a standard list of PEG words which you've already learned together, which you already know. The method of loci is linking specific information with a visual reference. Visual imagery, and this is what we're going to practice together here in a few minutes, that you're going to try this out and we'll see how good it works. Visual imagery is linking information to specific internal, in other words, in your head, a visual reference. And absurdity is, besides being funny, it can really help you to remember things. Humor with high levels of even silliness to make associations much stronger. Remember, the whole premise of these techniques is associating things. And by using a lot of humor, you strengthen those associations. You're even tying together stronger. So when the time comes, you're much more likely to remember that. Well, that first one was that visual PEG method. So what you would do in this case is PEG words, and you would have memorized these ahead of time, or any list you care to remember, things that you have already memorized. So the bun, zoo, tree, and door. Those are the words that you've already memorized and you already have down pat. And now the new words are bread, hot dogs, soda, and kiwis, like kiwi fruit. And so what you're going to do here, say you want to remember these things when you go to the store, and you associate the two, the one on the left with the one on the right. So you put the bun and bread together, and you come up with an image that puts those two together. You put the zoo and the hot dog buns together, and you come together with, it might be kind of silly, but the hot dog buns at the zoo, because you're associating with the new with the already familiar. The soda and the tree, you have a picture, it seems silly, but you have a picture of a bunch of soda hanging from a tree, because you already remember the tree and you want to remember the soda. The kiwis in the door, you have a bunch of kiwi fruit, like either hanging on your door or in your door to the point you're going to trip over them. And you develop the image of the first word together with the new word, the second, the linked word. Now, that takes a little work, it can do, but once you do it, you then can remember that paired word together, and that's how you remember it in this particular method, the PEG word method. The next one is the method of loci. And if you ever studied classical Greek or Roman literature, there was a classic reader called Cicero, and he, wrote a lot of things, and he also gave these very, very long speeches. And he used this by walking through the village that he was familiar with, that he grew up in, and each time he'd look at a building on his right or left, he would pair one of the passages that he wanted to remember in this long speech that could last like an hour or two. So, but the basic definition here, you use a visualization of a familiar spatial environment. In his case, it was walking through a familiar village, and to enhance recall. And sometimes, like I said, when you're like walking through someone, it's also kind of known as a memory journey. You pair this new stuff with this image of this place you know very well, and as you're walking through it, you pair these things with that familiar location, that familiar scene. So the steps in this, what you do, you decide on what you want to remember. You pick a place that's familiar to you, like somewhere you know well, maybe, where you grew up, a location you're familiar with, a hike you take through the woods where it's very familiar to you, a drive that you're really familiar with. And then you associate each piece of information that you want to familiarize with a specific feature of that location as you're going through that trip and that particular location. And to remember that information, remember walking through that location, or maybe driving, that you've picked, and recalling the information on your list, whatever that particular thing is. We used that PEG method earlier. Say you had that same list with those things. I'm just going to scroll back to the previous one to show that. Say we had the bread, the hot dog buns, and the soda, and the kiwis. We're going somewhere, and maybe the first thing we think of is our neighbor's house where he grew up, and we think of the bread all over, piled on top of our neighbor's house. The hot dog buns, the next thing we see is another neighbor's house that looks different, and we think of the hot dog buns on there. Maybe there's a road sign. This next thing come up. We think of soda hanging from that road sign. And the last thing is our kiwis. And then we, make a turn to the right. And at that turn to the right, boy, we have a pile of kiwi fruit. But it's using imagery with a familiar place, familiar location, and associating those new things we want to remember. And the next thing we're going to do is using examples of imagery and absurdity. So, and we're going to have you do a little homework here, okay? And we're going to just see how well this works. So, and to make this work, we're going to use a facsimile of my ID card way back when I was in college. I started college in the fall of '79 and graduated in the spring of '83. So you do the math, you can figure how old I am. And I went to a school, believe it or not, that was called Gustavus Adolphus College, named after an ancient king of Sweden in a little town called St. Peter, Minnesota, where I grew up in Minnesota as well. And I was the class of 1983, and I was student ID number 122. And, of course, there's my last name, Bergquist. And you saw my name earlier. It might be up there, but indulge me here. Bergquist is, B-E-R-G-Q-U-I-S-T. Think of me, I'm on a quest to climb to the top of an iceberg. I'm on a quest, even though it's really cold, I'm on a holy quest to get to the top of the iceberg. And here I am, I'm going up that iceberg, and I'm just on that quest. Even though it's cold, I'm sweating. I'm going up that iceberg, and oh my, I'm really journeying crazy. Here I am. Why am I doing this? I'm going up that berg, and I'm on that quest, and that's my name, Bergquist. You should change one letter. I'm on that quest to get to the top of the iceberg. So keep thinking about me getting to the top of that iceberg. I'm on that holy quest to get to the top of the iceberg. There I am. I'm at the top, and I've made it, Bergquist. And then my student number is, and if you can't see me here, but I'm about almost 6'4". I'm pretty tall. And when I was trying to get someone else to remember my number so I wouldn't have to bring my ID everywhere when they wanted to check my number, I said, my number is 122 because I'm the one who's too tall. 122, I'm the one who's too tall. 122, the one who's too tall. 122, one who's too tall. So think of that. I'm Tom Bergquist, and I'm 122. I'm the one who's too tall. In fact, I'm so tall, I hit my head on doorways. Think of me with bumps on my head, maybe an occasional drop of blood going down. Ooh, that's a gross image, but that's me. I'm so tall. I'm the one who's too tall. I'm the one who bumps into doorways. I'm 122. I'm the one who's too tall. Okay, there enough. So we've had our example of imagery and absurdity to remember my name, last name Bergquist, and my student ID number 122, the one who's too tall. Okay? Think if you can remember that. And then the last example, and this is, or the next category rather, is elaboration. Excuse me. And this is at the 5 W's: who, what, when, where, why. And to help us elaborate this can help us remember this. So I'm trying to remember something that happened in a particular event that I want to remember later. Well, if I answer these questions, that can help me. Who was there? What were we talking about? When did it happen? Where did it happen? And why were we even doing this? Now, I can do this internally, in my head, but it also might be good to use my, external device. And using these together, I can write down to help me remember this in my journal section, like who was there, what happened, what went on, when was this, what was the date and time, where was this, where were we, and why were we even getting together in the first place. If I answer all those questions, either in my head internally or writing them down if I need to, that's really going to help me remember this later, either internally in my head or even better, arguably, by looking at where I wrote this down to remember all that information and feel much better that I can remember that information at the time. One last category of these internal techniques, organizational techniques. Now, my guess is if in high school or if you went into college, you probably use these in helping you learn things. I use them all the time in classes that involved a lot of memorization, like anatomy or microbiology, to remember various nerves or that kind of thing. But here's one, if you want to remember the names of the Great Lakes, they're Huron, Ontario, Michigan, Erie, and Superior. And to help you remember the first letter of all those names, it's HOMES, H-O-M-E-S, or Huron, Ontario, Michigan, Erie, and Superior. A lot of students use that to memorize a whole lot of things. Another strategy that's, a great one that is used in actually tutoring or study skill classes is the PQRST. And just to make that stand out, I've made these all different colors. And this is kind of a self-instructional technique to learn and recall information, especially written information. You preview the information to recall. This is like if you need to study a book to take a test on it later, especially if it's not an open book test. Preview the information recalled. Ask quick questions about the test. Maybe if this book is divided into different sections, you might ask the questions based on the the different headings of the sections. Then actually after you've done all that, then you read the information to answer the question. So you don't even start reading it till you've previewed it and asked the key questions about the test. And then you state the answers, and if need be, if you can't answer the questions, read it again. And then you test yourself regularly. You ask yourself questions, to retain the information, and you do all this before you ever take the test. There's in all the things I've mentioned here, studies have been published on these, and if you do these, you're going to do better. You're going to remember more information. You're going to have better recall, better memory, and it's really going to help you a lot. But then the next question is, beyond these different strategies, so why would I make these changes? Why would I even use these techniques in the first place? What is that going to do for me? How is it going to help me? And I'm basing this discussion on several studies we've done, several years ago. And you can see the references there at the bottom of your slide. And research has shown that number one, if you measure your success when you're experiencing memory problems by returning to the way you did things before, in other words, if you're like, I don't want to have to write things down, I don't want to have to use these techniques, I want to remember things like I've always done, then you might be in trouble. Now, if you've always used these techniques and things, great. But if you haven't, we just met with someone, our team did, within the last week, and she's had some memory problems because of, in her case, in part because of chemotherapy she went through related to her breast cancer. And she's like, I've never had to write things down. I don't want to write things down. I never want to write things down. And we're like, well, if you want to go back to the way things always were, then you might be in trouble. But if you measure your success when you're experiencing memory problems, or any problems for that matter, by being open to doing things differently, using strategies which have been shown to enhance your memory or your thinking skills in other ways, then you're on your way. This is just a simple truth that, and this is true for a lot of other changes that happen with medical conditions. I think you probably heard this, but everyone knows that a lot of healthcare, most of healthcare, is managing chronic health conditions. It's not always about curing things, it's managing chronic health conditions. And managing chronic health conditions oftentimes means changing how you do things, changing your lifestyle, doing things differently. And if you can do that, then you're going to be much better. Next, research has shown that memory problems on formal testing, I think there was talk in Dr. Parsons' talk last week of neuropsychological evaluation, and that can be really useful as a detailed way. That's the kind of evaluation that really gets down into details about areas where you might be having memory and other cognitive difficulties. And that can be really good on detailing and finding out where your cognitive problems might be. But the memory problems or other cognitive problems shown on formal testing really don't determine how well you remember things in day-to-day life. Why is that? Well, what we've also found is that how well you do is really determined by how well you are at managing your memory problems. And there's studies, including our study that's cited there, but many other studies that show that that's what's the case. Why is that? Well, in part because that have gone through rehab, but in part because people just differ on how much to use memory strategies. That if someone who is just in the habit of writing things down, of using strategies, of referring to their notes, of doing all those kind of things, even if they have memory problems, that's going to be a better predictor of how well they're going to do in day-to-day life than whether or not they have problems on testing. So, and that's what we try to do in rehabilitation, is help people develop the skill and the strategies and the techniques that are going to help them, like I said before, compensate for or work around those memory problems when they recur. And that's why I'm encouraging you to do this. Last slide is that if you work to manage your memory problems, guess what? You're going to be more independent and you're going to be in a better mood. Forgetting things, losing track of things is very stressful. It's not much fun. It can cause a lot of, you probably see my picture. I don't have much hair to pull out, but sometimes it can cause you to want to pull your hair out. And your mood and your quality of life will be better if you're better able to manage your memory and other cognitive problems. And that's well documented in the literature as well. You know, this is a team sport. Having friends and family in your life that can help you with this can be really helpful. It can provide emotional support. It can provide, promotes using skills in day-to-day life. If your family knows that you're trying to do this and they're aware of what you're doing or aware of therapy you might be doing to help you with this, that's a good thing. They can help reinforce you to do that. It can reinforce the use of your thinking skills at home and elsewhere. It can improve your ability to manage your health by using these strategies to help you remember to do the things you need to do to manage your health condition. Take your medications, you know, eat the appropriate diet, be appropriately hydrated, whatever it is, do good sleep hygiene. And also improves your social life by helping you remember crucial information about social interactions or remember to do things that are part of enhancing your social life, like getting together with people. I know many people that, oh, I was supposed to get together with them, but I forgot to do it. So this can help you remember to do that. Now, what specifically, I'm assuming we have some supportive family members on here, and you might be asking, well, what can I do? What can I do to help my, you know, I always, for example, I'm helping them remember things. I'm telling them things because they keep forgetting them. What can I do that helps them do it more on their own? Well, you can, here we have it, different kind of cues. What can you do as a family member? You can use a direct cue, like, and that would be a family member telling me, you need to write this down because later you're going to forget it. And you might need to direct cue them initially because they forget to do it. But if you're direct cueing them, not just telling them what to remember, but if you're cueing them to use a strategy that helps them remember, then in so doing that, you are facilitating their independence and you're enhancing their memory. You might need to remind them rather to use the technique, but by using that technique, you're facilitating their independence. What's an indirect cue? That's a family member, you know, this person, they kind of know what to do, but they don't always use it. And so you're telling them, is there something you should be doing to help you remember it later? Oh, yeah, I need to write it down. Oh, yeah, that's right. And after hopefully a period of time of direct cues and later indirect cues, you, the person with the memory problem because of your medical condition, you tell yourself, whenever I need to remember something, I record it, whether I record it by writing it down or I record it another way, or maybe using a strategy, one of these other strategies, so I can remember it later. But I need to do something. But I kind of remind myself. I cue myself. It's a self-cue. And I think you need to ask yourself, are there other things I can do to enhance my cognitive functioning? Well, we've talked about these strategies here, and some of these are things which I think also Dr. Parsons talked about last year. You know, good sleep hygiene. Poor sleep is directly correlated with poor cognitive functioning. So anything you can do to promote good sleep will help you. Good pain management. Increased pain complaints by itself can be distracting and cause difficulty with cognitive functioning, including memory. Interacting with the world around you. The more mental stimulation you have in your life, you know, the more you're getting out of your comfort zone and getting out of your house and interacting with people, that's going to help you have a better quality of life. Regular exercise, of course, being mindful of any medical restrictions you might have, but exercise is shown in multiple studies to enhance brain function significantly, particularly memory function. That part of the brain, the hippocampus, is really sensitive to the effects of chemotherapy and other things, is also very sensitive to an oxygen-enriched environment by exercise. And so the more you can exercise, again, being mindful of any medical restrictions you have, that's most likely going to help. And just be informed about any medications you're having, any possible side effects they might have, because there could be something that could have a negative effect on your memory. I'm in no way saying you shouldn't take your medications, but it's also good to know that, oh, I'm having memory problems. It might be because I'm taking this medication. You know, I need to take it, but that could be why. That could be the explanation. You know, are there things about me which are getting in the way of doing the very things that will help me? You know, this kind of reiterates what I said earlier. You know, the more helpful things to do are being open to changes in your routine and new ways of doing things that are helpful, being open to receiving assistance from others if it helps you to be more independent. You know, being independent is not the same as doing everything on your own. Being independent is being strategic about when you need help and when you don't. You know, approaches that are not helpful is, you know, I just want to do everything like I did before, and that's the only indication that life is good is when I can do everything like I did before. Well, you know, life changes, medical and health conditions can change that, and if you go down that road, that's very likely to lead to disappointment. And if you view receiving any help from others as a sign of weakness and sickness and lack of independence, then that might be a big stumbling block as well that's getting in your way. And I think it's just good to identify, and this just doesn't apply to cognitive changes, this applies to other changes, of identifying potential resistance to making a positive change. Is making changes in how I conduct my day-to-day life hard, even if those changes make doing things better. It can be helpful to identify any resistance I have to make changes and doing things differently. If I do find that I'm being resistant to change, I need to ask myself, if this resistance is getting in the way to me making those changes. And if I'm not able to make those changes in a day-to-day life on my own, even those changes that will help me, then I really need to consider getting professional help with that issue. And there's many people like myself and other mental health professionals that, we work with people with mental health conditions, but we also work with people with chronic health conditions that, are having trouble making the changes that will help make their quality of life better. Just an example of kind of what I would call the right and the wrong questions. And by right and wrong, I'm not trying to make a value judgment. It's more just, are these questions that are helpful or not helpful? Do I want to do this? Versus, is this ultimately in my best interest? I might not want to do it, but yes, it's in my best interest. Is this going to be hard? Yeah, it's going to be hard. But what are the consequences of me not doing it? And what do other people think of me versus, is this going to help me meet my goals regardless of what other people think? So, hi folks, quiz time. We'll see if we can, I think we have to type in the answers. But do you remember my last name? And do you remember my student number based on the things we did before? Maybe we can get to that in the Q&A here and just coming up in a minute. But if you can, I want you to see if you can, because see if that technique we talked about was of any value. Here's the references that to the various, that slide earlier was the textbooks and the reviews. So that's in your slide deck as well. And then I guess we're at the point to, here's the summary, I'm sorry. Real quick, there's ample evidence of the value of cognitive rehab to enhance performance in persons experiencing problems with cognitive functioning due to medical condition. As I mentioned before, the strategies can be external or internal. The strategies that you use should be based upon your situation and tailored to meet your individual needs. And this is a key point, this fourth bullet point. That putting these strategies into practice can be really best done by working with an experienced therapist. We work with many people at our clinic who are here because of treatments they've had related to a cancer diagnosis. And the typical therapists that do this are occupational therapists or speech language pathologists. So it might be working with those professionals can really help you develop these strategies most effectively. And as I said in the last few slides, these strategies often involve making lifestyle changes, and this can be difficult and even distressing, but it's still important. And if you find that's the case, as I mentioned before, working with a skilled counselor who's particularly skilled at working with people with chronic medical conditions can really be another helpful professional to work with. So now we're to the Q&A part, and I hope we get some good questions, and thank you so much for your listening and for your attention.
Thank you so much, Dr. Bergquist. That was a very thought-provoking presentation. We will now begin the question and answer session. If you have a question for Dr. Bergquist, please use the chat box on the left side of your screen to submit your question, and we will try to get as many of those questions answered as possible. The first question refers back to your continued reference to a video that was produced last year with Dr. Parsons. People wanted to know where to find that. To find that video, you'll go to the BMT Infonet website, which is bmtinfonet.org. And in the upper right portion of the screen, you'll see a tab that says Video Library. And if you click on that, underneath you'll see a menu of options on the right, and you'll want to select the one that says Cognitive Problems, and then the first video on the list that appears will be Dr. Parsons' presentation. If anybody has any problem accessing that, just email help, H-E-L-P, at bmtinfonet.org, and we can send you a direct link to it. All right, well, why don't we start with the first question. After transplant, my husband often struggles to recall the word he wants to use. Should I help him by supplying the word, or will it help him more if he figures it out on his own?
That's an excellent question. And there's no right or wrong answer to this. I'm going to split the difference, and here's an idea. If there's, it goes back to that slide we showed on cues. If you're aware what he's trying to say and he can't, think of the word, I'll use an example. Maybe the word is, someone's from Boston and he can't think about the name of the city they're from that's Boston. You could maybe, give him the first letter of that word, or another reminder, it's a city in Massachusetts or something, so that with a little cueing he can come up with a word. Yeah, you're helping him, but he's still able to come up with that word, more or less on his own, as opposed to you telling him that word is Boston. Or say the friend's name you want to remember, her name is Sally. And, you could say, rhymes with Callie, I suppose. You could say, the first name of her word, or her name rather, is S. Now, it's probably good to talk about that ahead of time before you start that cueing just cold turkey between you and your spouse. Like, the next time you have trouble remembering that, sweetheart, was it okay if I cue you? Would that be a helpful strategy? And if you kind of get that agreement, then you can do that. And you might need to continue to cue that person, but sometimes once you've done that cueing for a while, it can be more likely over time that they're able to recall it on their own. But even if it isn't, it's still a way that people can at least, as opposed to being told the word or the name or whatever, that they can recall it more independently with the cueing than not being able to recall it at all.
All right. The next question. I had an allo transplant with total body irradiation 16 years ago. I noticed cognitive changes right away, but was able to compensate with a couple years when my memory started getting bad enough. I went to a doctor. I was having trouble recalling my pets' names, leaving burners on, etc. A couple years and a lot of testing later, I finally have an appointment with a neuropsych eval tomorrow. What questions are important to me to ask the person doing my evaluation?
That's an excellent question. I would say, besides the questions, I'll answer a question you didn't ask. I would imagine all this is in your medical record, but sometimes it isn't. We see people sometimes, and we don't always have all the details of their medical record. I think the facts that Susan just read would be to make sure that the provider doing the neuropsych evaluation knows that history from you. I would assume they're going to ask you all that, but to tell the timeline of your memory difficulties, when they started, when they became worse or became better, in relation to the medical treatments you've had. So that's really important to make sure you tell that provider all that information. And I think that the questions to ask them, and that might be in a follow-up visit later, is, to ask, well, what areas of cognitive functioning did you notice I had difficulty in? What areas maybe were stronger? What areas were weaker? Another thing you might ask is, I'm not saying this in any way, shape, or form, but sometimes, you've had a known condition. We've had people before that, for example, have had, been treated for cancer and have had, different things. But, sometimes their testing profile, that's difficult to, so the question would be this, the neuropsychologist, do you think all this is due to, what my medical history, my treatment for my bone marrow transplant treatment? And it could be, but it looks kind of like it might be something else. And in other words, you might want to make sure that there's not another medical condition going on. Now, I'm not trying to make anything scary here. I'm not saying that's the case, but I've seen it many times where you have this major medical event happen, and having cancer doesn't make you immune from having other conditions that could affect your cognitive functioning. So you want to make sure that you don't forget something, neglect something that could also be going on. Again, I'm not implying that's the case at all, but there's such a thing as medical myopia. You focus on the one thing you know is the case, and you forget that other possibilities might be going on. Now, with regard to the performance on the testing itself, that can inform to some extent what you might do if there are cognitive performance difficulties. I focused today, on memory, but you could have memory problems for a variety of reasons. You can show up on cognitive function, testing or neuropsychological testing as having true difficulty with memory, but many people show up and they really complain about their memory, but their memory testing looks fine. Does that mean they don't have memory problems? No, but they might have trouble, for example, on problems with attention. They might have problems, for example, on problems with executive functioning. If you go back to that filing cabinet I showed, that in order to learn new information, you need to attend to it. You kind of need to organize it. One gentleman I worked with years ago, when I showed him that same filing cabinet picture, he said, in my case, I think I have all these files there, but I think it's like they've been thrown all over the room, and I don't know where they are. So I think maybe I can remember this stuff, but I don't know where to look for it. So it's maybe more of an organizational problem, and that can be more an executive functioning problem. So you want to drill down into, okay, I think I'm having memory problems, but maybe there's something other than memory per se that's contributing to those memory problems. So I hope that probably answers more than the question you asked, but I hope that answers at least the question you asked and maybe a little more.
All right, we have a number of questions that are kind of a variation on this theme. This person's cognitive functioning is getting progressively worse. She's in her 40s, and she's wondering, is this something that keeps getting worse, or is it something that gets worse and then doesn't keep getting worse?
Well, in general, if you have a change in cognitive functioning after a medical condition, you can have that change, and then the aging process occurs. And then with all of us as we get older, especially into I'm in my 60s, 70s, 80s, to some extent in your 50s, that's when you start to see these cognitive changes with age. So what can happen is, say I had a bone marrow transplant and I had all the treatment that goes with it. Or even at a younger age, I had a traumatic brain injury, or I had a stroke. That can take some impact, that can impact your cognitive functioning. We typically expect that to be stable over time, but as aging takes on, you're kind of entering the aging process with a little bit of a disadvantage, that you've already perhaps had some changes in cognitive functioning, and the natural, normal, if you will, changes that happen with aging then take, more of an impact on that. A physical analogy would be if you've had some medical condition earlier in life that has caused some difficulty with balance, and maybe in your 20s or 30s you had some trouble with balance, but you're able to get by. And then you get into your 50s, 60s, and 70s where, unfortunately, the changes with aging can further impact your balance, that you really have more trouble with balance than we'd expect for your age. And what it can be is a combination of that medical condition and just the process of aging. Now, it also could be that as you're getting in those older years, that maybe some other, I kind of described this earlier, it's possible at least that some other medical condition like a dementia could be going on. That happens with a certain percent of the population. And in other words, it's just good to get that checked out. That am I having changes beyond what I had earlier in my life as I'm getting older, and just because I'm getting older with some changes that happen due to a medical condition, and or am I having, some other changes due to another medical condition that's a new thing? So the best way to answer that is just to get a thorough medical eval, possibly neuropsychological testing, working with typically neurology or even behavioral neurology is one of the best specialties to evaluate and answer this kind of question. Maybe they'll even do some brain imaging in some cases, but that can give you the best informed answer.
All right. A number of people have also asked, if you get cognitive issues after transplant, does that increase your risk of getting dementia later?
There's no literature I know that specifically says that, per se, that if you're talking about a degenerative dementia like an Alzheimer's disease or other kinds of dementia. I know when it comes to stroke and traumatic brain injury, the general consensus is, because that's a kind of a controversial thing out there, that those conditions don't really increase your risk significantly for having dementia either. Now, there could be some studies that I'm not familiar with in the bone marrow transplant letter that at least suggest that, but as best I know, those conditions by themselves don't increase your risk for getting what we would call a degenerative dementia. That's something that causes a more accelerated change in cognitive function, typically older in life, but it can start sometimes earlier in life. Alzheimer's disease is the one that people know the best, but there's other forms of dementia like Lewy body dementia, frontotemporal dementia, vascular dementia as well. That, to my knowledge, that is not a major risk factor for dementia.
All right. This person wants to know whether fish oil supplement is good for brain health, and if there are any foods that you should avoid.
Boy, that's a good question. That's been studied, to my knowledge, fairly thoroughly. There aren't any particular supplements. I know there was some stuff done on fish oil. Vitamin E was another one that was studied heavily in the past. There could be some nutritional benefits to that. I don't know that there's, in fact, I'm pretty sure there isn't a clear benefit for that in terms of enhancing cognitive functioning. But the things that generally help with enhancing brain health, and in so doing enhancing or at least preventing further decline of cognitive functioning are, I think there's 4 or 5 of them. One is managing your stress, your emotional distress that you might have in your life. If you have a mental health condition, it's getting treatment for that. A lot of people have stress in their life, and we can never really eliminate it, but we can manage it. So just simple stress management strategies, things like relaxed breathing, mindfulness techniques, all those kinds of things can really help to help you feel better, but they can also help to keep your brain healthier. Good, well-balanced diet. There's, I think from what I understand, the literature I know, the Mediterranean diet can be as good as anything. But just have a good balanced, nutritionally balanced diet. Regular exercise, I mentioned that earlier, is really good for brain health. Being social and interactive. It's kind of like the mental equivalent of physical exercise, that, being with people where you have to think, you come up with a conversation. Being at home and not being with people doesn't help you. And while video games can have some benefit, it's much better for you than doing some kind of video game. To having a real conversation with a real person, a real group of people is much better than it would be to, just, play with a video game or doing some kind of a video thing.
All right.
Those are the major things that help with brain health and help stave off, as much as we can anyway, cognitive decline with age.
Got it. All right, well, I think this is going to have to be our last question. Unfortunately, our time is getting short. What is your opinion about over-the-counter memory supplements?
Again, to my knowledge, there's not really much strong evidence that those make a huge impact. I know there's a lot of good sale pitches about those, but believe me, I work in an evidence-based world, and if we had a lot of data that those would help people, particularly people with documented memory impairments, we'd be suggesting them all the time. The one thing that we do suggest beyond the strategies I mentioned to you, and I've said it now, I think this is the 3rd or 4th time, is regular, especially aerobic exercise, and walking is as good as anything. We know there's lots of evidence with that in terms of, unless you're missing, like if you don't have B12 in your diet for an extended period of time, that can hurt your memory. So you want a good balanced diet. You don't want to have certain things missing from your diet, but there's not really compelling evidence that I know of that certain supplements are going to be the wonder cure to help you, enhance your memory, other than you don't want to, if it's supplementing for something you're missing in your diet already. So hopefully that answers that question.
Great, it does. Thank you very much. So on behalf of BMT Infonet and our partners, I'd like to thank Dr. Bergquist for a very intriguing presentation, very helpful presentation. And I also want to thank you, the audience, for your excellent questions. And I do want to note that there were several people who did pass your little quiz at the end, so good sign for them. If you, the audience, have any questions, please contact BMT Infonet if we can help you in any way. Enjoy the rest of the conference and have a good day.